Hello, it's me again, Dr. Babatunde Okewale. Today I'll be talking about 10 ways of treating abnormal semen analysis result. In one word, basically what I'm saying is how to treat male infertility. 10 ways we're going to talk about today. The first thing I want you to know is that the treatment of any abnormal semen result is individualized and is very dependent on the cause of the abnormality in the semen analysis. So we go straight away to the 10 ways. The number one way is through surgery. Why do I say surgery? There are some abnormalities in male infertility that are open to surgery. For example, varicocele. Varicocele is that situation where there is excessive vein around the testicular tissue. And what the excessive vein does is it produces excessive heat. And we already know that the testes hate heat. Anything that will heat up the testes will result in low sperm count. So there is an operation for that. It's called varicocelectomy, done usually by an urologist. There are some men that have had vasectomy done already. They've completed their family. And then they change their mind later on in life because they want more baby. Vasectomy is a cause of infertility because the vas has already been cut. So there's another surgical operation called the reversal of vasectomy. That can be done as well. That's number one. Number two way is to treat infection. We already know that there are some infections that affect the sperm analysis result. If you think it is the infection inside the sperm that is causing reduced motility, then you treat. The kind of infection we're talking about mostly that causes male infertility are chlamydia, gonorrhea. They need to be treated. That is, if they've not already damaged the testes. So, treatment of infection, if it's found in a semen analysis, is a good way to go. Number three is men who have sexual intercourse problem. We call it sexual dysfunction. There are some men that have erectile dysfunction, and that is the cause of their male infertility. There are some men that have what we call premature ejaculation. In such people, the best treatment is to refer them to a psychosexual counselor. They would help appropriately. Whether they need drug, whether all they need is just counseling, that will be given. We're still talking about 10 ways of treating abnormal semen analysis result, or in another word, treating male infertility. Number four is hormonal treatment. Hormonal problem is a rare cause of abnormal semen analysis. But where you do find that it is a cause, for example, if the testosterone level is too low, then you give a testosterone replacement therapy. If it is a situation of that the prolactin is too high, then you treat appropriately with the appropriate drugs. Number five way of treating abnormality or an abnormal semen analysis result is through assisted reproductive technique. You can decide to do IUI, especially if the sperm count is not too low. If the count is anything between 10 million and 20 million, then you can offer the couple a procedure called intrauterine insemination. The caveat there is that there's nothing wrong with a woman. She's ovulating well and her tubes are open. Other assisted reproductive technique methods you can use in abnormal sperm are in vitro fertilization, otherwise called IVF, and ICSI, intracytoplasmic sperm injection, especially in men who have severe male infertility. Number 6 way of treating an abnormal semen result is by the use of donor sperm. If the man has no sperm at all, a situation that we call azoospermia. Azoospermia that is not obstructive, because there are 2 types of azoospermia. We have obstructive azoospermia, in which case we can extract the sperm because it's just purely an obstruction. Or we have what we call testicular failure. If it is a situation of testicular failure, that means the testes cannot produce sperm. And in such situation, a donor sperm will come in handy. Number 7 way is if you have an underlying medical condition that is making your sperm abnormal or that is resulting in male infertility, then it's better to treat that medical condition, the underlying medical condition. What comes easily to mind is diabetes mellitus. Diabetes mellitus, untreated, uncontrolled, can cause a lot of problems. It can cause erectile dysfunction. It can cause retrograde ejaculation. If you have a cardiac problem, treat it. So if there's any medical underlying condition that might need to be treated, it might improve the sperm result. Number 8 is lifestyle correction. We already know that there are a lot of things we do that affect our sperm, ranging from smoking to excessive alcohol intake, and sometimes the kind of place we work affect our the quality of our sperm. We've already mentioned some of the workplaces, like in a printing press, in a plastic industry. You must protect yourself adequately, not to come in contact with a lot of the heavy metals that are used in such industry. If you work in the X-ray department, make sure you are properly shielded. Number 9 is sometimes, despite all said and done, there is no solution to male infertility, and especially when the woman has a problem as well and there is no solution. Adoption is an option. It is a treatment option. You can adopt a baby, and there are legal ways of going about that. We're still talking about 10 ways of treating abnormal semen result. The number 10 is by the use of drugs. There are many drugs in the market that have claimed that they can help in increasing sperm count. They range from anti-estrogen drugs that we normally use for women. The whole essence behind that is if we block the estrogen in a man, then his testosterone will be raised up and it will result in increased sperm count. There are other drugs like selenium, like vitamin E, and many others in the market. But the limitation of drugs are you have to take them for a long time, and there is no guarantee that they would increase the sperm count. Let me give you an example. If a man has a sperm count of 15 million, which is low, and that is below 20 million, and he uses a drug for 6 months, and after 6 months he goes to do his semen analysis, and it has increased to 30 million, it's been doubled, we would say the drug has done very well. Compared to a man who has a sperm count of 5 million and uses the drug for 6 months, and the drug doubles the sperm count to 10 million, we will still say the drug has done its job, but the count has not reached where we want it to be. So that is the limitation with drugs. Most of the time when you are using the drug, you are also thinking about something else that you need to do, either some form of assisted conception technique. So those are the 10 ways of treating abnormal semen result. If you want to know more about the treatment of male infertility, I've written 2 books that will be of great help, and both books are on Amazon. The first of them is called How to Get Pregnant and Have a Baby. The second is called The Art of Making Babies. It's a patient guide to in vitro fertilization. Both of these books are also available in Nigeria, and they can be easily got through all our social media. You can also contact us on our website, www.stivehealthcare.com, and we'll get one across to you. Thank you for listening. Please kindly subscribe, like, and share this video. God bless you.